All right, everyone. Welcome to Living Healthy and Aging Well. My name is Ken Hageland, and today is Saturday, May 30th, 2020, and we are broadcasting live from the AM 950 radio station that overlooks the beautiful Bryant Lake Regional Park located here in Eden Prairie, Minnesota. We are on the air every Saturday from noon to 1 to talk about your health and your life. We cover a wide range of topics to improve your quality of life, including wellness and health care, elder care, even end-of-life care, and of course, caregiver support. Well, I hope everyone's doing well today. We've had some crazy times here in Minneapolis over the last week, but we're going to take a break from all that and have a great show today. This is really going to be a fun topic to talk about. This really is important to listen to. So call your friends, make sure people are listening, because this is a show you just do not want to miss. We have Ron McGlennen M.D. He's president and medical director and the founder of Access Genetics and OralDNA Labs, and they're located right here in Eden Prairie. Along with him, joining him is Diane Larson. She is a registered dental hygienist and is the clinical specialist with OralDNA Labs. And we will be talking about the importance of using personalized diagnostics from your DNA to benefit your overall health and how their tests can identify and help address the 3 major dental diseases. You do not want to miss this show, folks. So here's the deal. Be sure and call us if you've got some questions. And I'm going to give you the phone numbers here in a minute. But don't wait till the show has ended to give us your questions. You have great questions. And let's get those on the air during the show. I also want to thank all of you that leave messages for us on our radio show phone line. We welcome your questions, comments, and suggestions. And also, please continue to let us know of topics or guests you would like for us to have on a future show. We are here to help you improve your quality of life. So feel free, call or text us anytime at 612-999-3426. Now, we'll give out that number throughout the show, so if you missed it, don't worry about it. But we really appreciate hearing from you. We are also adding new listeners to this show each week, and not only here in the Twin Cities of Minnesota, but also throughout the country. So I want to mention the purpose of this radio program is to bring you specialists and experts who have a passion for helping others by providing advice and recommendations on how to navigate the challenges of managing both you and your family's health and quality of life. We also have a special focus on our aging population and how we can help you and your loved ones prepare for the various stages of life's transitions. In addition, we provide vital information for the caregivers who are essential in supporting our senior population. Now, we get questions every week. How do we find recordings of your shows, Ken? Well, you can find these on the AM 950 radio station homepage by simply clicking the on-demand button and then clicking on our show logo, Living Healthy and Aging Well. Now, you can also find us on Apple iTunes, SoundCloud, and TuneIn as well. Now, you have 2 ways to get your questions answered today. You can call the radio station, and that number is 952-946-6205. Once again, 952-946-6205. Or you can directly text us your questions at 612-999-3426. And we look forward to hearing from you today. Do not be shy. If you've got a question, this is the time to get that question answered. All right. I want to introduce my guests for today's show. Joining me in the main studio here at AM 950 is Ron McGlennen, M.D. He is the president and medical director and also the founder of Access Genetics and OralDNA Labs. And also joining me is Diane Larson. She is a registered dental hygienist and is the clinical specialist with OralDNA Labs. Now, just to remind you, we're going to be talking about the importance of personalized diagnostics from your DNA to help benefit your overall health and how these tests can help identify and address the 3 major dental diseases. So hang on to your hats, folks, and get your questions ready. The show goes by fast, as you know, so get those questions ready and give us a call or a text. Well, anyway, guys, welcome to the show.
Good afternoon, Ken. Thanks
Ken.
very much for having us.
Well, I had Diane out to our medical practice
Yes.
in the last couple of weeks here and talked to some of our clinical team, and it was a fascinating conversation. And I said at that point, we have got to get you guys on the radio show here because what you guys are doing is just phenomenal. And with all of the focus in the news today about testing, we get you can't turn on the radio without hearing or the TV without hearing about testing and how our whole society's future kind of seems to focus on testing. But we're going to get some real practical testing information here about how people can really help manage and improve and maintain a high quality of life and health for themselves. Well, let's do this. Everyone loves to get a background on you guys. Ron, let's start with you. Give us your background and how you got involved with Access Genetics and OralDNA.
Well, thanks, Ken. I'm a Minnesota boy. I grew up in the South Minneapolis area, and I guess, the journey starts with my interest in science as a young boy. I always wanted to be a physicist, actually, and I liked numbers and math and that sort of thing. And so when the decision to go to medical school was presented to me, it was really out of the advice of my physics teacher who told me, your personality is one that befits going into medicine and caring for people. My career started actually at the University of Minnesota Medical School, followed by specialization in pathology. And we'll be talking about testing because the pathologist has this image of, forensic medicine and doing autopsies and determining the cause of death. But quite frankly, the bigger part of that specialty is about running laboratory tests and understanding how tissue is affected when disease occurs. My career was launched in the era when DNA, the stuff that makes up who we are and where we come from, became a material that we could work with. I remember starting my career at the university as a young professor, and quite frankly, my boss gave me the keys to an empty room and said, "Here it is, make something of it." We didn't know what to do with DNA at those times, and our dance card with tests and interests and diagnostics became filled up very quickly. About 10 years into that business, I began to realize that molecular and DNA testing needed to be made available more broadly. So I created a company called Access Genetics. I mean, the name, I think, speaks just exactly to what I was trying to do. I was trying to make genetics available and accessible. So our initial business endeavors was about helping other laboratories learn what we knew how to do. And so we set up labs across the United States. Now we're going to be talking about OralDNA Labs. That was actually one of our customers early on, and we acquired that business. We helped to set up a model idea that said, let's apply DNA testing to dentistry. And that has, to a great extent, commanded our interest in the last 10 years at Access Genetics and OralDNA Labs.
All right, so, but your headquarters is here in Eden Prairie.
Correct.
Right across the freeway from where we're broadcasting.
Right. I think you make a point. We're a Minnesota-based company, 19 years in its existence, and we've had our ebbs and tides, but we are successful, and we're gaining traction very significantly in the last year for sure, but probably more so in the last few months for reasons we'll talk about. But I think one of the things that I'm very proud about, and with all the colleagues that I work with, is we endeavored into showing how we could use telemedicine and bring the laboratory to remote locations and to unusual healthcare settings. So the issue of this high-tech DNA stuff, we tried to bring it down to the earth and make it practical and everyday and commonplace. And part of the story today, whether we be talking about tests available to dentists or even in the case of COVID testing, is a good DNA test at its heart is a yes-no answer. It says disease, no disease, and then we can start to add in other features that provide personalization. You can't do that with all the other conventional ways of doing laboratory testing.
All right. We have a lot to talk about here. I want to make
Yeah.
sure we get Diane in here the last minute of the segment.
All
Give us
right.
your background.
Yeah. Well, Ken, I am a dental hygienist. So I am from the Midwest. So Minnesota is home right now. And I fortunately worked in a couple of practices here in the Twin Cities, taking care of local, and found OralDNA and said, wow, this is really amazing. And when it came to the point where they were looking for kind of educators in the area, I stepped up and said, yes, I want to be one of those lucky hygienists that can really make a difference, not just in the small patient base that I was working in. So, yeah, and that leaves me to here where I talk to clinicians every day. Every once in a while, I talk to a patient and just help them interpret the test results and figure out what to do next.
Oh, fantastic. Well, listen, folks, it's time for a short break. We'll be right back to continue our conversation with Ron McGlennen M.D. and Diane Larson. And we're talking about the importance of using personalized diagnostics from your DNA to help benefit your overall health. Call us 952-946-6205 to get your questions answered when we return. You are listening to Living Healthy and Aging Well. Please stay with us. All right, welcome back, folks. You are listening to Living Healthy and Aging Well, where we talk about your health and your life. My name is Ken Hageland, and joining me today in the main studio of AM 950 is Ron McGlennen, M.D. He is president and medical director and also the founder of Access Genetics and OralDNA Labs. And along with Ron, we have Diane Larson. She is a registered dental hygienist and is the clinical specialist with OralDNA Labs. And we are talking about the importance of using personalized diagnostics from your DNA to benefit your overall health and how these tests can help identify and help address the three major dental diseases. Now, to get your questions answered, we're going to talk about a lot of important information here in the next three segments. So to get your questions answered, please call us at 952-946-6205 or text us at 612-999-3426. All right, before we get back to our conversation, though, I want to mention that this radio program is brought to you in part each week by Minnesota Hospice. Minnesota Hospice is an independent, physician-owned medical practice serving our local communities for over 12 years with innovative and comprehensive end-of-life health care. If you have any questions regarding end-of-life care or support, please contact the compassionate team of experts at Minnesota Hospice. Their phone number is 952-898-1022 or visit them online at minnesotahospice.com. All right, Diane, would you let our audience know if they have more information or questions? Yeah. Is there a phone number or a website that you'd want them to
Oh, most
to
definitely.
use?
Our website is www.oraldna.com, and our client services can be reached to answer any questions at 855-ORAL-DNA, which is 855-672-5362. You'll find a lot of great information on our webpage. Find a provider section. We've got a patient section. For our healthcare professionals, there's case studies, there's blogs. It's just a great website just to get all the necessary information of all of our services.
And it's a very easy navigational site, too. There's a lot of great information.
Thank you.
It's a very technical area, but it's been done so well. It makes it easy to read. And as I mentioned, you came out to our practice a few weeks ago and helped instruct some of our team about all the services you guys have, which is a lot of services. And we'll try and touch on as many of those as possible today. But folks, yeah, it's a great website. And this can be a new area for people. Even though
Yes.
genetic testing has been around for a while, not a complete generation yet, but it's been around for a while, but still it's so new.
It is.
And that's what the goal today is, to bring that down to people's level of understanding and why it's so important to pursue that or look into that. All right, well, Ron, let's get back into our conversation here about the oral systemic connections. And we were talking a little bit off the air here on how important the health of your mouth is important on the health of your body.
Mm-hmm.
For millennia, different cultures have looked at ways, the window into the soul, the window into the body. And I think today it's fair to say that if we look into the mouth, we are going to learn a lot about what's going on from head to toe. And we very much embrace that idea when we talk about tests made available to dentists and the primary diseases that they see in the dental office as a pathway into conversations with cardiologists and rheumatologists and all the other specialties that deal with chronic health conditions. So let's just talk about a simple example. The simple example is atherosclerotic heart disease. When I went to medical school, it was about the knowledge of bad cholesterol, how much, what types of cholesterol, and we all work today to manage those different types of cholesterol. Well, the truth is that some people with high cholesterol don't have heart disease, and some people with low cholesterol, good cholesterol, do have heart disease. So what's the difference? We believe today that inflammation as an overlay to cholesterol is an important consideration of the multifactorial understanding of heart disease. So where does that inflammation come from? Certainly one of the major sources of inflammation comes from the mouth. And in no uncertain terms, gum disease, we call it periodontitis, is a major driver of inflammation in the mouth, and it spills over into the body.
So I know when I go to the dentist, they always ask, do you have any kind of heart condition? Or they ask now more health-related questions that are not just limited to the mouth. Mm-hmm. And in fact, some of the issues are, if they do dental work, make sure you have a healthy heart. So it's interesting how I've seen changes just in how the whole dental care process has taken place over the last few years.
And we strongly encourage dentists to take on that yoke of responsibility, to start taking more and more health histories. The truth is, most patients see a dentist much more frequently than they do with their physician. So if you're looking for an opportunity to prevent, have that conversation with your dentist, and in reciprocal, make sure your hygienist or your dentist asks you questions. Their charting, their acknowledgement will help to, create conversations with the right physician-based practice.
Now, we were talking off the air, even though you have a great website and great information for people, individuals can't actually call you to get a test done. They have to work through their dental provider or really any provider.
Yes, that's correct. So we don't do direct to patients currently. That may be something that we look forward to in the future, but dentistry is, the dental professional component, or any medical professional component, is integral for the care and the interpretation of the results. So we've decided that that's where we want to, focus going through to get that patient the proper care.
Because with the diagnostic information, you need to have then it tied to a therapy.
Correct.
So again, giving this information, which is great information, to an individual without, again, a link to a therapy being administered by a licensed practitioner.
Yep.
you kind of a dead end in a sense.
Correct.
We don't want to encourage people to make
knowledge is
treat
good,
themselves.
but you have to be able to act on it, and most patients aren't able to act on it.
Right,
So.
right. Now, even though the results, I've seen samples of your tests. I mean, they're very clear. And again, what's nice is you guys offer a service to be able to then help
Correct.
interpret what those results are. So when a person is working through their dentist or their chiropractor or their nutritionist or whomever these
Correct.
licensed practices are, to help understand their health, and as Ron was saying, try to get a handle on chronic disease, which is just so prevalent in our society. They've got you and your team to be able to help get information and interpretation.
Correct. Myself, everybody else on the team, we consider ourselves an extension of every healthcare provider out there that is part of the OralDNA system.
All right, great. Unfortunately, it's time for another break here, folks. We'll be right back to continue our conversations with Ron McGlennen M.D. and Diane Larson. Please stay with us. All right, welcome back, folks. You are listening to Living Healthy and Aging Well, where we talk about your health and your life. My name is Ken Hageland, and joining me today in the main studio here at AM 950 is Ron McGlennen M.D. He is President and Medical Director and the founder of Access Genetics and OralDNA Labs. And along with us is Diane Larson. She is a registered dental hygienist and is the clinical specialist with OralDNA Labs. And we have been talking about the importance of using personalized diagnostics from your DNA to help benefit your overall health, and how the tests that they have can help identify and address the three major dental diseases, which we're going to talk about finally in this segment. So to get your questions answered, folks, do not wait till the end of the show. Please call us at 952-946-6205, or you can text us at 612-999-3426. All right. Hey, before we get back into this great conversation, I want to mention that there's a new in-home support service program called Neighbor Care being offered by one of our show partners, Episcopal Homes. Now, if you or someone you know is struggling to maintain their living independently or is considering a move to an assisted living community, please call Neighbor Care first. Now, Neighbor Care is a new kind of in-home service that is more affordable than traditional home care providers. This innovative new home care service is designed to help older adults remain independent by making in-home support services more affordable and accessible. Care providers can help with daily tasks in smaller time increments, even multiple times each day as needed. Now, this unique support service is offered 24 hours a day. This new program is being offered by Episcopal Homes in St. Paul. For more than 125 years, Episcopal Homes has been serving the Twin Cities and understands the importance of a safe and supportive home environment. Their program, called Neighbor Care, is currently providing services near the Episcopal Homes coverage area within the urban core of St. Paul. This service benefits from financial support from the Minnesota Department of Human Services, which recognizes innovation is needed to help support older adults living well at home. For more information, please call 651-444-4000 and ask for Karen Bento, and find out if Neighbor Care by Episcopal Homes is available in your neighborhood. Once again, that number is 651-444-4000, and ask for Karen Bento. All right, Diane, let's let our audience know how they can get in touch with you if they have more questions.
Yes, so our website again is www.oraldna.com, and you can reach our client services at 855-ORAL-DNA, which is 855 888-672-5362.
Fantastic. All right. Well, Ron, we've been teasing the audience here about the 3 dental diseases that you guys are experts at in terms of identifying through your amazing testing services. Let's let the people know, what are those 3 dental diseases?
Let's give it a name. Yeah.
Yes.
Gum disease, also called periodontitis. Cavities, also called caries. And oral HPV, I don't have another name for it, but that's one of the concerns that lead to oral cancers.
So that's pretty important, because when Diane was out talking to my staff, and we're talking about the different services and the tests and what they're for, that one got everyone's ears going right away. Well, it tests for cancer. And, of course, in our practice, we treat people at end of life that many times have cancer. It's the leading cause of death in our practice area. So how many tests do you have that you offer to people through dentists or through other providers?
Well, I don't, right off the top of my head, actually memorize 6 or 7, but the 3 big ones that we're going to talk about really, really quickly, the first is something called MyPerioPath. And we started this conversation by talking about personalization. Well, MyPerioPath is my personal, periodontal, and path refers to pathogens or bacteria. One of the themes in all of our tests is that we're looking for infections, and we're using very cutting-edge technology, the DNA from these organisms, to find and measure that. Now, dentists do a great job, and hygienists, their colleagues, do a great job of caring for these diseases, but our tests help those professionals get at the cause. If you know the cause, you treat the disease, you can then see the effect on improvements and prognostication. So those stories are forthcoming every day, and I'm going to ask Diane to just share a little case report of how this all plays out.
Yeah, and you can view some of our case studies on the actual web page, where you can see what the treatment was provided, the before and after test results. But there's too many to think of how many conversations that I've had, so I'm just going to think of the most recent one that I had this week. A hygienist called and was just like, I don't understand. This patient has so much signs of disease, but the MyPerioPath came back relatively insignificant. Traditionally, that hygienist would have just dug in and pulled out a lot of antimicrobials and a lot of antibiotics for that patient because they didn't know. And with the test results, that hygienist was then able to kind of take a step back and say, all right, what's the bigger picture? And I said, what's the medical history of the patient? And they said immediately that the patient had Crohn's disease. And I said, you were probably the major reason for this patient's inflammation is because they have inflammation in the lower GI tract. It's not working properly. It's most likely that they're going to have inflammation in the upper GI tract. But now you've got a better way to treat them. You can then say, instead of me throwing a lot of antimicrobials at you to get your infection, or what I'm assuming is infection because that's what I've done for this long of time, I now can help you figure out how to better manage your Crohn's.
Wow. So that's a different medical specialty versus dentistry.
Exactly.
But well illustrates the fact that all of these organs and all of these systems are connected. And I think we play a critical role in bringing dentists in closer conversation with their physician colleagues. And every day, through case studies such as that, we're facilitating that dialogue.
Interesting. Now, I just want to make sure I'm clear with the DNA part of the testing you do. You're testing the DNA not of the patient necessarily, but of the infection or the bacteria, right? Or
sometimes.
That's the elegance of taking this simple sample of salt water, swish, gargle, spit. That takes some of the cells from the inside of the mouth. That's the human DNA signature. But along with that are the bacteria, any viruses, all the things that reside in the mouth, all that's in one sample, and we can get at the DNA information from those respective organisms.
Okay.
So we do have genetic tests as well, too. So if you wanted to know, is there a genetic likelihood? And then that case study that I just did, they did do the genetic component, which is called MyPerioID. And from that patient's parents, one parent did pass down a genetic variant that makes them more pro-inflammatory. So there's another piece to the puzzle that dental professional now has.
Well, that's a great tool in terms of the prevention side.
Correct.
So that people know, okay, I need to be aware of this and then have their plan of care for themselves to prevent disease from happening.
Prevention, but also, as you said, plan of care. I mean, treating the infection in the first amount of time, but then communicating with the patient, look, we're going to see you more often or less often based on your genetic susceptibility to this disorder.
Right, right. All right. So that's the MyPerioPath program. Now, what other ones do you guys have?
Well, it like I said, head to toe kind of thing. We've got the OraRisk Caries, which also is a bacterial DNA test. So it looks at the 3 bacteria that causes caries. You know, this is a test, our caries is something that is kind of a mystery. And so having that piece to the puzzle may give them some answers. And then we have a very exciting one, which gains a lot of traction with patients, is our OraRisk HPV, which is a risk assessment for oral cancer. It's not detecting if they have oral cancer at that point in time, but it's telling that patient if they are at risk. HPV is a very common infection.
Mm-hmm. And so are dentists identifying these potential symptoms or what patients are presenting at the time and then saying, well, I'm recommending we get this test done to the patient, or how does that conversation go in the dental office? Because I think people are going to want to start asking their dentist or their hygienist about these type of tests.
And it really depends on the test. So the MyPerioPath, in most cases, it is generally they're seeing clinical signs, and then the professional presents it to the patient saying, hey, this is what we need to know in order to personalize your care. When it comes to the OraRisk HPV, that is one where there are no signs and symptoms. This is a risk assessment test. You're at risk. HPV is very easily transmitted. I can't tell. I can't see a virus. We can't see viruses. So let's do a test to determine if you have an infection or not.
Okay.
But to be clear, patients and their professional, talk about this reciprocally. Patients come to the dentist and say, I'm worried about my risk for oral cancer. But the opposite, sometimes the dentists are a little reluctant to bring that topic up. And so, these tests have unto themselves a certain provocation of topics that have otherwise stayed in the backdrop. We're not afraid of that. We're proud to bring these health issues forward because there's nothing more heart-wrenching than somebody who develops an oral cancer and has a major surgery and has a life-altering effect when they could have prevented it by simply doing one test.
Right, and the tests are quick. Could we just kind of walk through what the tests like? People get nervous about tests. They needles or pain or whatever. So maybe, Diane, you could just tell us how simple and easy the tests are.
So simple. We even have some healthcare providers that, under the guidance of their healthcare provider, they're actually sending the collection kits to the patient's home, and the patient is actually doing it at home. So in our collection kits, there is a vial of sterile saline, and they will simply swish and gargle. They will then expectorate that solution, which has been a testing medium for all of that bacteria, human DNA, viral cells. They will then spit that into a funneled test tube. That funneled test tube, we add a preservative to it, and that gets shipped to our lab at Eden Prairie for analysis, depending on what you have ordered, what you want to know, or we can actually order all of the tests in our test menu from one collected specimen.
Okay, that's important to know. Mm-hmm. It's not multiple tests, collections you have to have, just one collection, and then you guys can do the test from there. All right.
Yep.
Boy, I'm sorry. At this point, the music is cueing us out here. It's time for a short break, folks. We'll be back for our last and final segment. If you have any questions for Ron or Diane, please get those to us here for the last segment. Call us at 952-946-6205. You're listening to Living Healthy and Aging Well. We'll be right back. All right, welcome back, folks. You are listening to Living Healthy and Aging Well, where we talk about your health and your life. My name is Ken Haglund, and joining me today in the main studio of AM 950 is Ron McGlennen M.D. He is president and medical director and also the founder of Access Genetics and OralDNA Labs, located right here in Eden Prairie. And also Diane Larson. She is a registered dental hygienist and is the clinical specialist with OralDNA Labs. And we have had a fascinating conversation here about the amazing technologies that they employ to help do great diagnostic testing for your health in partnership with your dentist or your chiropractor or any functional medicine practitioner. So if you have any questions, please give us a call at 952-946-6205 or text us at 612-999-3426. You've only got about 6 minutes left, folks, to get that question to us, and we'd be happy to answer that. All right. Well, let's I know I wanted to get to this topic earlier in the show, but you guys can also do testing now for COVID-19. And that, of course, is on everybody's mind. I mean, the whole country, the whole world now knows what the word COVID-19 means. Diane, why don't you maybe introduce that testing service to us, and we can talk more about that here in the last segment.
Yeah, great. And, this was something that Ron and I were on a business trip in early March, and he's just like, what do you think? Do you think we need a test? And I was just had a couple of questions. I'm like, I don't know. Would we really use it? And guess what? A lot of our healthcare providers, especially here in the Twin Cities, have definitely stepped up and are utilizing it to distinguish who has the virus, who can potentially, go in for those elective surgeries. So it is the same 30-second swish and gargle. We do have a nasal swab component to it. And, you get the test results within 1 to 2 days. And so, Ron, why don't you go ahead and explain more of the technical?
Yeah, if there was ever a time in my career and for the life of our business, this was the mission that we needed to step up to. And dentist's office were deemed non-essential. I have problems with that, but nonetheless, they shut down dramatically, and we had no need for the test for that moment. So we pivoted very quickly to develop a very robust test for COVID. Now, initially, our mission was to help out, take care of very sick patients here in Minnesota, but it became very clear in a moment that we had to start thinking about how we were going to get Minnesota back to work, how are we going to get people back in the dental office? And we have a model now that says, as Diane pointed out, there's two components to the test. One, do you have the virus or not? That tells you whether or not you're contagious and whether you're on a path towards illness. But the second part of it is now you can use that information to go back and conduct your life. Dental offices can open up with this information. And so the service component of getting that answer out in, as Diane says, within 1 to 2 days, quite frankly, we're pushing really hard to make it less than 1 day, makes that test relevant. So if there is ever a time in my life where the word test can held up and said, this is what everybody needs to study and think about, and what's the difference between these tests, this is it.
Okay. So maybe let's unpack that a little bit further here. It's the test will tell you if you have the virus.
Yeah, I'll be very clear. There are many types of tests being discussed.
Right.
This is a diagnostic test. They also use the word PCR, or polymerase chain reaction. We're using these molecular technologies to look for the presence of virus in the nose and in the mouth. And if it's there, that patient is infected. It doesn't tell you anything about whether they have symptoms or not. And every day, every week, we're learning that a great proportion of people don't have symptoms. But here's the problem. If you're asymptomatic and you have the virus, you can still spread it. And that's where outbreaks occur, and that's why this epidemic, this pandemic, continues to perpetuate. So our job is to test as many people and find out who has it and who doesn't, and to then allow those people now negative to continue to conduct their life, and to remind those who are positive to please take that quarantine and wait the time out until they get well again.
So the test really helps you with what steps to take, what path to take in terms of being able to return to work or return to activities or return to what you're doing, or you've got a quarantine.
Exactly.
I can tell you that we all are experiencing this, and there's a lot of high anxiety. And dental hygienists are number one for contracting COVID-19. They are number one. Number two is pulmonary, and number three and number four are dental assistants and dentists. So they are a high-risk profession. This test will allow them to know that their measures as far as social distancing, what they're doing as far as infection control, the PPE in their office, by them taking a test, they can then be rest assured that they know that their measures are working. Then they can also explore to, getting those patients in for surgeries, getting them in for procedures that maybe are producing those aerosols that are going to put them at risk. So if they know that their patient's negative, they know that they're negative, then they can perform that surgery without that high anxiety.
Right. It's now only a couple minutes left here. I want to get people, I'm sure, curious, how expensive are these tests? Because they're very high tech, very state of the art. What kind of price range are we talking about for those type of tests, or this test here?
The test is $110. It's
is that all?
It's competitive with everybody else that provides such a test, and through the dental office, it can be transacted with cash, or it can also be reimbursed through medical insurance. Sometimes the patient has to file those claims. If you go through a physician office, however, we're finding the experience that many medical insurances do cover the cost of that. It's critical to know this information.
All right. Well, we are out of time, and we could just spend the next hour talking about this. But Diane, let our listeners know one more time how they can get in touch with you if they have more questions about the COVID test or any other test we've talked about.
Yep. Online, you can find us at www.oraldna.com, or you can reach out and call our client services, which is 855-ORAL-DNA, which is 855-672-5362.
All right. I want to thank Ron McGlennen M.D., President and Medical Director and the founder of Access Genetics and OralDNA Labs, and Diane Larson, a registered dental hygienist and is the clinical specialist with OralDNA Labs. We have been talking about the importance of using their personalized diagnostics for your benefit, for overall health. And I want to just tell you folks, please reach out to them, get on their website, look at the information they have. It's great information. We hope you enjoyed today's show. Please contact us with any questions or comments you have regarding today's conversation, or let us know of topics you'd like for us to discuss on future shows. You can always reach us by phone or text at 612-999-3426. Please join us again next Saturday at noon for another live broadcast. And thank you for listening to Living Healthy and Aging Well, where we talk about your health and your life. Until next time, live well.